everybody, it's Gregory Zarian from Healthline, and here we are. Wait, stop. Let me do this over. Healthline has a new look, a new name, and we also are bringing to you a new face. Hey everybody, welcome to Healthline from A to Z. New co-host, Dr. Narine Artunian. I'm going to call her Doc. Welcome to Healthline. I'm going to call it 2.0. How are you, Doc?
I'm doing great, Gregory. How are you?
Well, you're my doc. She's my doctor. Am I looking okay?
You are doing just great. Very good, very good.
Thank you.
We're here. Welcome to A to Z Healthline show, and I'm very excited to have our show with together with Gregory Zarian, and it's a completely new show. We're going to be together. We're going to talk about lots of problems. We're going to tell you how to stay from emergency room today.
How to stay out of the emergency room. Now, for those of you that may not know Dr. Artunian, she did Medical Mondays. She now has Healthy Living with Dr. Artunian, and we decided to combine forces, the voice of the people, a doctor, and also talk to specialists throughout the community, and also appeal to you throughout the country to bring you all you need to know about a healthy lifestyle. Now, Doc,
it's going to be hard.
It is going to be hard.
Yeah.
But we can do it, right?
Because you're a professional. It's going to be hard.
Okay,
really
but come
hard
on.
for me.
How many doctors look like this? So here's my question. It's summertime.
Yes.
A lot of things happen during the summer.
And
I think our first show should be based on how to keep people out of the ER during the summer.
I agree.
So what do you think? What do you think is the most important thing about staying out of the ER this summer?
Well, the most important thing staying out of ER this summer would be hydration, stay inside, stay cool, and drink lots of fluid. Use your sunscreens, even though we can talk about natural sunscreens, which is antioxidants, because sunburns, sun heat, it's all inflammatory reaction to heat. So that's what we need to do. Just stay inside, drink lots of fluids, and stay tight with your doctors. So if you have any unusual symptoms, you can approach to your doctor, and we can discuss and help you. But for now, I think we should go in.
Now here's the thing: as we're going in, not all of you are going to stay inside. Not all of you are going to drink a lot of water. It's summer. You're acting. You're at the beach. You're playing. You're at the gym. So we're going to give you some easy, simple tips to do all that you love. Remind you to throw on your sunscreen. Remind you that even though you're in a pool, you still need to drink your water. So come with us as we keep you out of the ER this summer season.
Do you know how many glasses of water they need to drink?
Between 8 and 10. And if you're a little more, right, am I good?
Yeah.
And if you're a little more active, between 12 and 14. And did you know that you can also overdrink water? Come on. We're bringing you into the emergency room at Greenville Medical Center,
where a lot of
exciting things happen. Come on. Here we have some VIPs. We have the gorgeous Terrell McDougall. Hi, Terrell. Love you so much.
We are going to go to the next room.
And we're coming to the next room. What's the next room?
The triage. Hello.
This is triage.
Hi. Triage when you first see the patients,
okay,
and when they tell their problems, and right here, this gentleman and this young lady are probably going to take vitals, meaning the blood pressure, pulse, and oxygenation, and ask for all problems and ask why they're here. Gregory, are you okay?
Oh my goodness, I'm a little faint. I was swimming and didn't have a lot of water. I think I need a doctor.
Oh my God.
What happened when you were swimming?
I was sinking underwater.
Did you fall in, or somebody pushed into the water, or you were just swimming?
I was swimming, and I'm not that strong of a swimmer, so my family was a little bit worried, so we thought we'd bring me here.
Okay, so we need to do some vital signs,
okay,
do a blood pressure, a pulse, check your oxygenation, and once we get all that done, then I can take you in to see a doctor.
So what's next?
Well,
after you've got your vitals,
if we have an empty available bed, we'll put you immediately in a bed, and a nurse and a doctor will see you in a very short period of time.
Okay, so you do have two types of patients. One of them who can walk in and tell you the whole story, and the second type of the patients, they're just coming with the paramedics, ambulance. So what kind of triage are they getting?
Usually when they come in by the ambulance, whether it be EMTs or paramedics, the charge nurse will usually meet them in the hallway and then at that point determine what the appropriate bed is for them. If they're really sick, maybe they're having a heart attack or low blood pressure, or they're combative, they put them in a special room that will accommodate them the most.
Very good.
Joining me now is Dr. Sylvia Kotikian in the ER. Doctor, summertime, patient just brought in.
Sure.
Dehydration. How do you treat that?
So, you know, it really depends. So the reason I'm holding this chart is just to show you, we get a set of vital signs.
Okay.
So when they came in, you probably saw in triage, they got
Well, I did that. When I walked in, I actually went through the process of
blood
triage.
pressure, they got the heart rate, they got the temperature. So it really depends how quickly we see the patient. If we're really busy, depends on those vital signs. If there's a patient that's crashing on us, obviously we're going to see them very quickly. And what does crashing mean? So fast heart rate, their temperature is high, their blood pressure is low, you're going to see a doctor there very, very quickly. So if it's something that's a little bit milder, generally we encourage just oral hydration. So Gatorade is great. It's got a lot of electrolytes, a little bit better than water because electrolytes are not in water, so Gatorade is better. If it's somebody that looks like they need an IV placed, then the nurse would be at the bedside placing an IV. What is an IV? It's a big, basically drinking a bunch of water we force into your vein, right? So
which hits your body quicker.
Very quickly, and people resuscitate much more quickly having the IV placed rather than drinking.
Okay.
And so people sometimes will get 2 big bags of fluid put in them and they feel a million times better, right? If it's somebody that's really bad off, so we've given them 2, 3 bags of fluid and they're still not doing well, then that's the point where we think about admitting them to the hospital, because sometimes it takes a few days and a few bags of those fluids going in constantly. So that's the spiel on dehydration.
And one thing that I do want to say too, though, is if you have a headache, it could also mean that you just need a glass of water. A lot of headaches come up from being dehydrated. Now, since it is summer, what are some other maladies that happen during this time of year that people actually come into the ER for?
You know, we see a lot of trauma in the summertime because people are very active. So as much as they can, they should wear protective gear if they're going to be out on, you know, playing football or they're going to be playing
when you
soccer.
say protective gear, what are we talking about?
We're talking about helmets, we're talking about the elbow guards, the knee guards, as much as you can to keep yourself from on impact having a big injury.
Okay, great.
And so we see a lot of broken bones, we see a lot of lacerations or cuts when people fall. That's much more in the summertime because people are out and they're having a good time.
What about snake bites? Because we are located in the mountains. We have some really great mountains around here and throughout the community. What do you say about that? What's a great way to take care of yourself if you do get a snake bite?
Well, very rarely do we see snake bites here, and generally when people get a snake bite they call 911 and they're triaged to a hospital that's much more, sees a lot more of snake bites. But basically, don't suck on it, don't put a tourniquet on it, just basically keep it clean, call 911 and be transported to your nearest hospital that deals with snake bites.
Poison oak, what about poison oak and poison sumac?
So you can put, basically, if it depends on, again, the severity of it. Sometimes we see a lot more of the severe ones here in the ER. If it's something that's a little bit less severe, then they can just buy over-the-counter hydrocortisone and apply it right on there. Again, soap, water, keep it clean. You don't want to put 100 things on there because all of the stuff you're putting on there, if you're not clean about it, you can get actually infected. So you want to just use soap, water, and then hydrocortisone if needed.
Okay, my last question, doctor. A lot of families have pools. Sure. And a lot of families have children that go out and play, and maybe somebody turns this way and the kid's near the pool, the child is near the pool and everything. What do you say to a family that maybe the child has gone into the pool and they may be worried about their breathing and they drank too much water and stuff? What are your thoughts on that?
So hopefully there's more than one person there. If there's not...
That's so important. I'm sorry for cutting you off. If you have a pool, do the right thing, get a pool fence.
Yes, it takes seconds.
And more than one person to watch your loved one.
Yes,
Continue.
And the reason is if something tragic happens, like that child is in the pool and they're not breathing, you don't know which one to do. Do you get the kid out or do you call 911? And ideally speaking, you want to have the child out of the water as quickly as possible and you want somebody to call 911. So it's, hey, call 911 right now, and I jump in the pool and get the child out of the water. And then of course it depends on how badly the child is doing. So it is the most devastating thing that we see. But if you can, if the child is not breathing, you just need to start CPR until EMS arrives.
And as far as CPR...
I'm sorry to cut you off, but you don't turn them upside down, the water doesn't come out that way, nothing like that. You just put them and you just put them on the ground, you start CPR if they're not breathing.
And here's the thing, if you do not know what you're doing in regards to CPR, call Glendale Adventist Medical Center and they will show you exactly what you can do. So doctor, this patient is doing okay, right?
Doing okay, going to be great, going to be discharged home.
Okay, great. So can we find Dr. Artunian?
Sure, absolutely.
She's getting into trouble. More when we come back on Summer Health and how to stay out of the ER this summer season. We'll be right back.
Hi, we're here today with Dr. Melitonian. She's one of our well-known ER doctors, and I'm pleased to have her here next to me. She's a really good help for our community because she speaks Armenian, Spanish,
English,
and Farsi.
A little bit of
Farsi.
Bit understanding.
Well, that's a lot. I'm impressed. I want to talk about summer problems that you see more here. What kind of problems you have here more? Summertime.
Summertime, people are outdoors. They're enjoying being out in the community. So we do see people with bee stings or different types of bug bites because they're outdoors and maybe hiking, things like that. Especially with hiking, people sometimes will sprain their legs or break their leg being active. Important things to remember, especially as children are biking, that you make sure you're wearing your helmet. The adults need to display good behavior so that the children learn that. So wearing your helmet all the time is important. Again, just practicing safe techniques. So we end up seeing a lot of these patients when they come through the emergency room afterwards. Not necessarily intentional, but inadvertent accidents do happen.
So it's important for all of us to know that summertime, lots of activities outside, but in the meantime, we need to remember how important is hydration and sunscreens.
Right.
Sunscreens and try to stay away from heat, and especially for elderly people. Their immune system is down, they're taking lots of medications, and the adjustment system is not just really good. So they really need to be careful. They need to use their air conditioner, and if they don't have an air conditioner, they can be in big areas, around the pool. So I know from my practice that heat exhaustion, the symptoms are people are sweating a lot, and then they're experiencing fatigue, dizziness, and at some point they cannot produce any more. They don't sweat, they don't have any energy at all to move. That's the time when they're coming to you. Now, before they reach you, I ask them to cool down with anything's possible. Anything's possible, whatever is around. But if they are here, what is the next step? How do you help them?
Well, first we have to realize that the problem is that they're having heat stroke or heat exhaustion. Because they don't know, and a lot of times they're so confused that they're unable to explain it. So first we have to diagnose that problem, figure out how warm they are, and different techniques of figuring out how warm they are, and then begin the cooling process. And in the process, you have to make sure their core temperature, their inside temperature, may be 103, but you have to make sure that there isn't an infection at the same time. So you're ruling out all the other problems. So infection, they're altered, so you're making sure they haven't had a stroke. And then after that, you start doing the rest of the techniques to try to cool them down, whether it's spraying them with cool water, taking all their clothes off, and just bringing their inner temperature down. Your brain can't process anything appropriately when it's that hot.
Okay, very good. And also I think it's very important to mention that when people come with any type of trauma, this is the first step that we put the splint. If they have different problems, they need to follow up with their doctors, and they need to be seen by ortho. This is not a last step.
Right. Well, what we will do is, if there is a sprained ankle, there's no broken bone, then a lot of times we'll put a splint on and refer you out to an orthopedic surgeon. If there's a broken bone, sometimes we'll try to adjust the position. Once we adjust the position, we'll put a splint on to try to maintain it. We definitely don't want you to take that splint off, and we'll recommend that you see an orthopedic surgeon usually in 2 days for them to potentially readjust the position of the bones and then to put a definitive cast on. The original 24 or 48 hours, there's too much swelling, and there's continued swelling after a broken bone. So the last thing you want to do is put a cast on and squeeze
more than
broken
yes,
bone.
I agree. And it's a difficult time of the year we see lots of sick people, and sick people, elderly people, over 65, they come more to ER in this season. We do have lots of heart attacks, we do have lots of strokes happening at this period of time, and we are really good, this hospital.
Right. We're a stroke center, we're also a cardiac, we call it STEMI center for heart attacks, and we have the specialists and the intensivists that can treat a stroke when it's happening. We have a cardiologist who can open the blood vessel and get the blood perfused properly. So this is an amazing center to come into. And of course we have fast track, we have our emergency room where we can take care of some of these things.
Everything is updated, even though they updated about 6 years ago, is that right?
September will be 6 years that we've been in the new emergency room. We have about 36 beds. We have a fast track with our physician assistants that can see patients and try to get them back out. So you will see a doctor or physician assistant definitely within 30 minutes. And most of the time we'll try to get you home between 3 or 4 hours. And that's the worst case scenario. Sometimes it'll be in a half hour, 45 minutes, you'll be able to leave, depending on the circumstances, whether we need x-rays or any additional
or anything else. Well, I thank you very much, Dr. Melitonian, and I see Dr. Ira Petian there. Now, Petian, if
Dr. Arbi Nahapetian is here.
He is here. He's a cardiologist.
And he's also the vice president of medical affairs at this hospital.
Very good. So we're going to follow with him. Thank you.
Thank you.
Well, I'm glad you're here, Dr. Nahapetian, because we were just talking about the coronary artery disease, about the heart attacks and stroke, and about your big role also as an administrator in this hospital, even though we renewed everything here about 6 years ago, but we still need your help, and we're hoping that everything will move forward in the right direction.
I'm glad to be able to help, but this is a fine institution that only needs certain tweaks, and part of what we're trying to do is expedite some of the cardiac care and the stroke care that we're already very, very good at as we expand our service line and start taking on referrals from other hospitals, some of our brothers and sister hospitals, and some of the hospitals that don't necessarily have the capacity to treat some of these more serious conditions. We've had to ramp up and expand both our physician workforce, our nursing expertise, and some of our technical expertise. And we're now at a point where we're functioning where most university medical centers function with respect to treatment of heart disease, which includes heart attacks or MIs, strokes. We actually are now getting referrals from other counties, whether it's Kern County, Ventura County, Santa Barbara County, to be able to take care of some of our sickest patients. Some of our physicians here have expertise in very rare areas of stroke care, of cardiac care, and we are thankfully able to provide these services to our grander community, not only our local community, but beyond.
That's very nice. Do you have a patient here? That's why you're here
I'm
in
actually heading to see my own patient. So
very good. And I want to mention one more thing, that Dr. Nahapetian, he's an electrophysiologist who can place all those AICDs and pacemakers and everything else. So good luck. It was nice seeing you.
Great seeing you. Take care.
Bye-bye.
Come with me and join one of my favorite ER doctors, Dr. Anthony Cardillo. Hey, Dr. Cardillo, how are you?
Fine, thank you.
So, doctor, we're in the ER, want to keep people out of the ER. Talk to me about food poisoning in summer.
Well, it's a very important issue because, as we all know, we're out eating at parties, barbecues, the temperature's very hot. Food has a tendency to get spoiled if it's not prepared properly, if it's not stored properly. Also, you're at a party, several hours go by, and you forget that the potato salad's been sitting on the counter for several hours.
Baking in the sun, no less.
Baking in the sun, exactly. So a lot of factors come together in the summertime to make food poisoning a reality, and it makes it a little bit higher frequency. So, things to be careful of. Number one, be suspicious of food that's not covered properly, that taste funny when you take a bite. You'd be surprised, and we've all done this. You eat something and say, that kind of tastes odd, and you keep eating it. If something doesn't taste well, it's been sitting out for a while, or it's been in the refrigerator for several days, don't eat it. If you go to a restaurant, you eat some food that doesn't taste good to you, tell the server, I'd like to have another serving because it's probably spoiled. And that's a big thing. The second thing is also we have a lot of close contact during the summertime. People don't realize that some types of food poisoning is transferred from person to person. Unfortunately, people use the restroom, they're not as hygienic, they don't wash their hands as well, and then before you know it, you're shaking someone else's hand and you transmit a bacteria or a virus. So clearly, a lot of people coming together is a risk factor for food poisoning as well. So be careful what you're eating and be careful who you're shaking hands with. Basically, that's
the bottom line, wash your hands. But doctor, what are some of the signs and symptoms of food poisoning?
Okay, so we always try to differentiate food poisoning from other serious illnesses like appendicitis, for example. But if you have nausea, vomiting, high temperature, the vomiting then progresses to a diarrhea illness. That's symptoms of food poisoning.
And people then come to the ER for food poisoning.
Because they're dehydrated. That's the big issue. If you're vomiting so much and having so much diarrhea, you're losing a lot of volume. They come to the ER because of that, and we have to rehydrate them.
And one great antidote is to have Gatorade at your house?
Gatorade at your house. Watered down Gatorade is the best.
Okay, and also sip some water. Doctor, since summer is casualties everywhere, what kind of emergency kit do you think people should have at their house?
Well, at home, it's wise to have the basic supplies for any bleeding injuries, any laceration injuries, and really for rehydration. There's not much that you can do at home to tell you the truth for serious injuries, but you know, the ice, the ACE wraps, the small Band-Aids, things like that at home you can take care of.
And your final thought, doctor, to everyone to have a safe summer?
Well, the big thing I always talk about is pool safety, and so watch the pool with the kids. Pool safety is high regard, okay? And then also watch your children carefully.
And here's the thing, too, that I'm just going to say this, is parents, if you decide to have a couple cocktails and you are outside by the pool, make sure someone that's not drinking is with you as well so they can pay more attention to your children. Doc, I'm going to pretend to be an ER doctor and walk around, and we're going to join Doc. Should I put the coat on? Fantastic. And we're going to find Dr. Artunian, and we're going to share with you our final thoughts on summer safety health.
Gregory, are we done?
I think we got a lot of tips out for the summer and what to do to stay healthy. Drink lots of water, pay attention. The most important thing, too, is know where your local hospital is.
We should ask them to write down whatever we say.
Oh, here's the thing. Exactly. Take notes, write down everything. And also, because you can see us on YouTube, push pause and write down all these great notes. Because we have this amazing team that is giving you life-saving tips.
Well, it's important to say that we've been doing separately our shows, but now we're all together and we're here together, and we're a team. Right. And we really want to talk about smoking. Just maybe in 2 minutes, 2 seconds, each of you relay the message to our community, because this is huge. That's why we're so busy in this ER. That's why we do have lots of heart problems, lots of stroke, lots of high blood pressure. So, Dr. Melatonia, your message to our viewers.
If there's anything you can do to save your life, to prolong your life, to improve your life, you've got to quit smoking. It's not worth it financially, it's not worth it for your health.
Dr. Cordero.
If not for you, do it for your family, your children, your grandchildren, because they will miss you serially.
Absolutely, it's not good for anything. We're seeing people in their 30s that are coming in with massive heart attacks, massive strokes. Age is no longer a factor. So if you think you're just going to smoke now and then quit later, it's no longer, that's not the game anymore. So just stop now.
And one thing I want to say is, after smoking for 20 years, 2 packs a day, smoking is so not cool. And my father would say to me, why would you make something so small so big in your life? So make a choice. Put the cigarette down and get your life back. Dr. Artunian?
Mentioning your father's name, my great friends, who is going to be always with us, I want to end with the geste that he's always been doing at the end of his show. Bye-bye.